Hello folks, this is Dr. Boer reporting to you today on the arthritis. There's many different kinds of arthritis out there. It's become epidemic. Between 40 and 50 million Americans are afflicted by it. And the arthritis is a medical term for a broad spectrum of arthritises. Osteoarthritis, rheumatoid arthritis, lupus. The list goes on. And it's something that is considered one of the top priorities in the health professions simply because it can be so debilitating. And in the arthritis, there's a lot of cousins, a lot of autoimmune diseases, even osteoporosis, and we're going to talk about it. It's a very important topic. So this thing has been around for a long time. I remember even an article describing arthritis in mummies. This is really interesting because only the pharaohs, the kings and the queens, thousands of years ago showed very significant degenerative joint diseases, whereas their helpers, which were also in the same graves, really showed beautiful joints well into late life. And it shows you that even back then, lifestyle made a huge difference because obviously the pharaohs, in order to show their wealth, had a very meat-driven diet, whereas the more poor helpers were more doing the lowly vegetables. And hence, look at the results. It goes beyond the joints. They also found that early heart disease and all kinds of degenerative conditions were present in the pharaohs that was not present in their helpers that were buried with them and were the same age. For my doctorate, I had to write a paper, and my paper was on rheumatoid arthritis. And even back then, over 25 years ago, I wrote that rheumatoid arthritis was linked mainly to leaky gut syndrome. We're going to discuss that soon. The gut is a big portion of your immune system, about 70% of it, and when it gets irritated, it will attack joints, skin. Everything inside of you becomes inflamed, and this destructive process is especially noticeable in the joints, and therefore it becomes an important facet of treatment in the functional method of treating osteoarthritis. So another point about it being lifestyle related is I'm a fan of the old masters, being from the Netherlands. We have a lot of fantastic old painters, Rembrandt, Vermeer, on. And Vermeer had this great painting, I believe it's 15th, 16th century, of this guy sitting in utter misery with his swollen feet in this bathtub, like it looks like a pail of warm water. Steam is emanating from that, and here he sits drinking wine, and he's got all kinds of carcasses of meat that he's consuming. And even back then, it was obviously shown that slothfulness, the lifestyle of the rich back then, was very much a prominent factor in these arthritis. So with that introduction, I want to first cover the Western medical way of treating the arthritis. Non-steroidal anti-inflammatories is most common. I did a little research into its effectiveness. One, we know that it does reduce pain without a doubt. Remarkably little though, about 28–29% after a month of use. And that is the very best one. They average around 22% reduction in pain. What was very disturbing about it though is some of the side effects. Some of the side effects include stopping the effects of healing. In other words, it's difficult to heal osteoarthritis when you're on these NSAIDs, as they are known in short form. It also has a destructive factor on the cartilage that surrounds the joint. It actually accelerates joint loss, cartilage loss. The whole arthritis can actually be caused by NSAID. So symptom management, yes. Making the progress worse, absolutely. What was very disturbing also, some serious side effects. For example, Tylenol in a 3-month period, according to the FDA reporting on adverse events. This goes back in 2008, period from January to March, shows that Tylenol alone caused 1,459 disabilities, 1,553 deaths. Aspirin was responsible for 716 deaths and 678 adverse events. Ibuprofen, 357 deaths, 347 adverse events. It goes on and on. This is just in a 3-month period, folks. I can't imagine if just say an herb like echinacea caused 5 deaths. the uproar that that would cause. But here we are, sticking our head in the sand, doing things that are just not really good for us, killing people, and yet we continue in this foolhardy fashion. There has to be a better way to treat these arthritides, and let's explore what we do in functional medicine. In functional medicine, we actually promote exercises. It goes counter to the feeling, because obviously if your knees hurt, your elbows hurt, your shoulders hurt, you want to keep it quiet and sit and maybe even ice or put warm on it. But that is the wrong approach. You need to get the joint moving for healing to take place. I like rhythmic motion, not harsh motion. Things like walking, cycling, swimming, just even smooth motion. And that can be extremely beneficial for healing these joints. Obviously, losing weight can also be very beneficial. For every 5 pounds lost, there's 15 pounds less pressure on the hip and on the knees every step you take. So that can be very significant. And oftentimes, if the lifestyle change is appropriate, and that's what's causing the weight loss, that causes less inflammation, and that obviously goes after the causative factor as well. Reduction of gut inflammation is paramount. We have been able to link leaky gut syndrome to the arthritides for decades now. And really, the way it works, 70% of your immune system is your gut. So if that is inflamed due to Western lifestyle, too many antibiotics, medications, stress, wrong foods, food allergies, I can go on and on and on. What can happen is this inflammation from the gut gets transferred over into inflammation of the immune system, and it becomes a global event. It will hit even your brain, it will hit your eyes, it will hit your skin. Your joints are going to be affected. One of the first things that you notice really is your joints, and that can be the cause of osteoarthritis. Also, something very interesting happens. We have a type of white blood cell, they're called Th cells. And these Th cells are responsible for immunity, for recognizing self, for recognizing bacteria, tumors, on and on. And the balance of the Th1 to Th2 cells becomes very abnormal with leaky gut. And you get too much Th1 cells, not enough Th2 cells, and that is exactly what attacks joints. We have methods of countering that as well. I'm going to cover that in a minute, but it starts in the gut, so you really should work on the guts by eliminating foods allergies. Most people, that would be dairy products, it'd be gluten, too much sugar, others it could be corn. Whatever the patient is sensitive to, we take that out and promote a very Mediterranean style diet that's very rich in oils, healthy proteins, and reduces the refined carbs almost entirely. So that alone can make a significant impact on the arthritides. What we also do is we load on the good oils. We especially like using something called omega-10, and this special fish oil is one of the most anti-inflammatory oils on the market. It is so anti-inflammatory that you can see marked reduction in inflammation within 1 month. And it is so anti-inflammatory that I see all kinds of other inflammatory conditions improve at the same time. Skin, brain, heart, on and on it goes. Arthritis is not an isolated thing. It's part of a global complex of inflammation. We also utilize a very novel product made from hops called THIAA, T-H-I-A-A, all capitalized. And this product has been tested extensively and published here in North America as well as in Europe. In my home country, they found that THIAA, when mixed with an extract of chicken cartilage, brings down that Th1 dominance. Remember those Th cells that I was talking about? So therefore it can be used with autoimmune disorders such as lupus, psoriatic arthritis, rheumatoid arthritis, and yes, osteoarthritis. It quiets it down so quick that in my experience, I've seen it work better than some of the most potent medicines that are out there. At the same time, it has those hops extracts, this THIAA, and I see flexion in the knee improving by at least 10 degrees within months without any further exercise. I see joint swelling coming down. I see pain reduction go way beyond what medications can do. So I'm really excited about this. It's combined in a product called Osteovantiv. And usually 2 per day is what I recommend, and it can be used long term. There's a lot of published results also on glucosamine sulfate, and glucosamine sulfate is a tricky one because there's a lot of fake ones out there. Glucosamine hydrochloride being one of them. It really doesn't hardly work at all. I have found that glucosamine sulfate, when mixed with a little chondroitin, is the best way to attack it, and there's more than 60 studies done in Europe alone on its effectiveness, reducing inflammation in the knees by about 70% and hip inflammation about 60%. There is no drug out there like it, folks, that can match that, and there is really no side effects known. Another thing that we do at DBC is something quite revolutionary, and that's acoustic compression. And acoustic compression I'm really excited about because it is a sound wave that is so powerful it can reduce inflammation, literally push it out. You can watch swelling go down. It brings in neovascularization, which means new blood vessels start forming. It also brings in stem cells, which can regenerate cartilage. It can reduce bone spurring. So really, you're talking regenerative stem cell therapy here. This acoustic compression is used also for acute injuries. It can be used for a lot of things. In Europe, it's even used cosmetically to reduce wrinkling and scar tissue. And in our hospitals here, it's used in a more focused form called lithotripsy, where we use it to get rid of kidney stones. So that can be done as well, and we treat anything from hips to knees to fingers. We just completed a case in our office, and this 74-year-old gentleman who's been a patient of mine for over 20 years was so thrilled because he was scheduled for knee replacement, and he was really looking up against it because he'd had a few other surgeries and he was not pleased with those. And he said, "Doc, what do I do?" He says, well, just give me just a little while. Let's try this. I've had good success with this." And he comes in and he said, "Doc, I just canceled that surgery. And look," and he did some squats and knee bends. He said, "It's hardly any pain." And we did that with acoustic compression, good fish oils, the osteoventive, and lifestyle changes. We took away gluten, we took away dairy, we took away the inflammatory sources of food. And it's amazing how even well into older age, you can repair some of these joints. So don't give up hope. Don't sit on the couch and suffer and just take Tylenol. Get moving, change your foods, use the appropriate means that are out there, and let's get rid of some of these arthritis. It can be done at any age. You'd be shocked at how you can reverse some of these joint degenerative conditions. Thanks for listening today. We'll talk to you next time.